part of your practice is focused on women experiencing breast implant illness or BII or BIAI, breast implant associated illness, right? What extra steps do you take to help them feel heard and validated and cared for?
Um, well, I think we just spent the time to talk about it, and my consults are typically scheduled for an hour and a half, and frequently they run over that. And the reason is that because I really want to understand where the patient's coming from and see what their concerns are. So I ask them a lot of questions about what are their symptoms, why are they here, what do they think is happening, and then I'll ask them a lot more pointed questions also. How is your posture? How is your musculoskeletal? So how is your breathing? How's your sleep? How is your anxiety? And then also, if there is any autoimmune disorders that you think, have you seen any specialists like rheumatologists or endocrinologists for some diseases that may have crept up over time? And then once I get their full story, then I sort of offer my experience and like, well, this is a situation that I've seen on a lot of patients, and this is the consistent outcome on the other side of the surgery when we explanted. The whole conversation takes a lot of time, but it's very, very validating. Spending that time is I think the biggest key.
Well, and I know that you do that because I see people's reviews of you and if they go review you on Google or they review you on Yelp, I respond to all the reviews and thank them but I'm seeing what they're saying. And so I know you validate them and I know that you do all the things we're talking about on this episode because the proof is go over and read these for yourself and see those reviews, and I see them every day. And so that says so much about, I mean, people could go in and they could give you 5 stars and not write anything, but they don't. They write big paragraphs of how you impacted their life and in a positive way. And I think that's what a wonderful um, business to be in, or what a wonderful specialty and job that you have. Not everybody gets a job like that where they get to make huge positive differences in people's lives.
So just to add to like the final word on what you said before is just I think the way I just practice medicine is how I want to be treated or how I want my family to be treated. And this is just the right way to do it. And I think this felt right for me. And I never thought this was something special or something that has a label of concierge on it. But if that's the case, then so be it, I suppose. But yeah, I think that's where it sort of evolved into.